Hey everyone, Dr. Keith here. Hope you have an amazing day. We're just having a little live webinar here on what we had in the office the other day, which was Can Kids See a Chiropractor? So if you do have any questions at any point, feel free to ask, or if you watch this later on after the live feed is done, just go ahead and either comment underneath, or you could always call us or send us an email. And it's just going to be a really short version of what was happening the other day. And obviously, if a chiropractor is doing a webinar on can kids see a chiropractor, the answer is probably yes. We're going to go into detail on, what to look for, how that's done, what some of the advantages are. So we'll just start. Just a little bit about me. I am a fourth generation chiropractor. We see infant to elderly. We've seen just a couple old babies. I've seen all the way up to age 99. And so we've seen a variety of different people, and we change our technique in the way that fits that individual, just like we actually do with everybody. We're going to do it to what's ever going to be best for you individually. And with chiropractic, it can be for everybody. It can be for anybody. And everybody can benefit from it, because what we're doing is we're making sure that the body is functioning optimally. And when the body is functioning optimally, the normal state for the body is health. So in order to get there, though, you have to give it certain things. And some of these are very basic. So obviously we need water, we need food, we need certain movement. The spine is involved because it protects the nervous system and the immune system. And so it really helps when those are functioning properly, that the brain and the body are able to communicate together optimally. And so a lot of times we'll see this with, people are like, well, why do kids need to go to a chiropractor? They're not old, they don't have these problems, they don't have back pain and neck pain. Well, it can even start with birth. So a lot of times the birth process can cause different problems, specifically in the neck, but it can be anywhere in the spine. Just think about it, when even in a natural birth, sometimes there's just a little too much pulling. If there's a little pulling going on, and that little bit of extra pulling is very stressful on the baby, because there's almost no muscle tone going on. And especially if we have like a C-section or a vacuum extraction, those can be even more stressful a lot of times on those areas as well. And so a lot of times we'll see some issues in those areas. And really the only way to know if there's any problems in those areas is to get them checked by a chiropractor, because no one else is checking for these things. It's important that you get your baby checked, as soon as possible, really, just to see if there is anything wrong. You really, just like anything, you don't want to wait until some symptom is kind of occurring. And so a lot of from birth, there's a lot of things like that can happen. And as they continue to grow, there's all kinds of other things. Obviously when they're moving around, they're going to be falling out. When they're learning to walk, as they grow older, different playing, just falling down. Kids fall down all the time, different sports. And other things that can cause stresses too are, dietary things. There's a lot of dietary things that can cause stresses on the body, as well as a lot of even emotional things. And it's hard to kind of think of that a lot of times with kids, but a lot of times kids can have emotional things that affect them as well. But with chiropractic, we're always just checking to make sure everything's functioning optimally. Especially with kids, we use very gentle techniques. With especially infants, we're going to use really light pressure. Most of the time we're just going to use our fingertips and just apply a little pressure and hold it in a specific direction that joint needs to go, or that bone needs to go. And so it's very light. It's not scary. A lot of people who've maybe have been to the chiropractor or have seen videos of chiropractors, and they think, oh, they're cracking these kids' backs, or there's nothing involved like that. Even with the adults, everything is very calculated to what is really needed at that time. And that's what we check for. We check to see what is needed, and when something is needed, we deliver that force into that area. And as I kind of mentioned before, whole purpose of this is to make sure that the spine is functioning optimally, because it's really the connecting point of the brain and the body. And so that nervous system, and that affects the immune system. It's going to affect all these different systems, so they can function optimally. So we do see a lot of different. Sometimes we do see a lot of symptoms that do go away. Some things that are very common for kids to present with when they're young, especially, is kind of colicky symptoms, ear infection. One really simple thing to look for is breastfeeding difficulties, or breastfeeding if it's a little different on different breasts. So maybe that you notice that they're not turning their head as much one way or the other, and they can't latch on to one side. That can certainly be an indicator that there is some problems in the neck there. Crawling problems, walking problems. Torticollis is some relatively common in a lot of kids that have. It's thought that it's a lot of muscular tightness, and a lot of times the muscles are definitely tight, but a lot of times there's a joint issue with it as well. Different allergies, immune system problems is something that can happen as well. As we get older, we see things present like ADD, ADHD, autism, asthma symptoms, seizures, different coordination issues, headaches, kind of scoliosis, and then as we get older, more sports issues. And so there's a variety of different things that can be affected. And really, it's just about making sure their spines are functioning optimally. And that's what we want all our kids to be functioning optimally, but a lot of times we overlook that. Just like you're going to start taking your kids to the dentist, and you're going to take them throughout their life, and when they get to adult, they can make their own decisions on how often to go. But as you're taking your kids to the dentist to get them routine checkups to make sure they're cleaned, making sure they are brushing their teeth and all those kind of things, you have to do the same thing with your spine as well. So it's just really important to always be working on optimal function of the spine as well. We do have some different systems we use to check in the office. When they're infant, we won't use a lot of them, but even that they're relatively small, there's some different scanning systems we can use to kind of help see what's going on, give us some ideas of how things are progressing or changing, kind of going back and forth. Because we don't need the symptoms to tell us what to do. We're just checking to see how the spine is functioning. So a lot of the kids that do come in don't have any symptoms whatsoever. Or maybe they did have some symptoms, and then they kind of got more on a wellness care program, and that way they're preventing things almost, you could think about. And as I said, most of the time we're doing really light forces with these kids. There are, sometimes we will use a little instrument as well on a very light setting, so they may see that as well if you're in the office. But really, we're going to care for the kids just like we would adults. We're always going to be trying to do what's best for that individual, the force that is best for them. When we have a really old individual, we're going to use the force that's good for them, and when we have a really young individual, we're going to have the force that's good for that individual. So if you guys do have any questions, feel free to send them over, comment below, and I will try to get back as soon as possible. Like I said, this was just kind of a little short version of what we did the other day. We will certainly have another talk in the office, most likely in the middle of November, but stay tuned for dates for the Kids Talk. We do have other talks coming up, and those talks are available on our website for the next couple Tuesdays. We are having different talks, so feel free to stop by the office on 6:30 p.m. on the next couple Tuesdays, and we'll see if we can help you become healthier. I'm Dr. Keith. Choose to be amazing.